Thank you, everyone, whoever stayed this late in the afternoon. I feel fantastic. I hope you do too. I have no disclosures. I have no stock in Botox, and I will neither confirm nor deny ever having Botox injected in any part of my body. So let's get started. It's a little brief overview about why I started using Botox for my abdominal wall reconstruction patients and why I love it so much. So this patient is a bodybuilder and a personal trainer, and I met him 1 year after he underwent a laparoscopic Nissen operation. On postoperative day number 1, he was reported to have abdominal compartment syndrome, at which point they took him for an X-lap, they nicked his bowel, and here we are a year later when he came to my office wanting this hernia fixed. Now, when I looked at a CT scan, it wasn't that the size of his hernia is very impressive. It's about 10 centimeters. But look at the size of his abdominal muscles. I mean, that's really bulky. And, it's the job that he does. But also, on examining him, his abdominal wall is really non-compliant. So I had a few concerns with this patient. My one concern was, how am I going to pull this guy back together again when he's so non-compliant as far as the abdominal wall goes? And if I have to do a TAR on him, is this going to affect him functionally? Clearly, he uses his abdominal wall differently than the rest of our patients do. So I asked IHC, I said, what do you guys think about this situation? And Sharon Tofai recommended that I try Botox. And I thought, why? Why haven't I thought about this before? This is a brilliant idea. I mean, after all, I've had years and years of experience with Botox. Not in the way you guys think. I've been using Botox for the treatment of anal fissures for years. Inject 100 cc's into the internal sphincter, and bam, my patients are happy, I'm happy, everything's great. So now I'm really excited about using Botox for my abdominal wall reconstructions. But first, what I need to do is learn. I need to learn how to do this technique. So I read this paper. I highly recommend it. I think it's the first paper written on it, written by our colleagues down in Mexico, about how to do the injection. Then I posted on IHC again, asking those same surgeons, please share your videos with me. I want to know how you guys do it. And there it was, the videos. The third thing I did was recruit one of our interventional radiology doctors. This physician can do anything under ultrasound guidance. So I said, help me do these injections. So then we got started. We do this in the IR suite. The patient has a little bit of sedation. We give local anesthesia. We mix 100 cc's of saline and 100 units of Botox. And we pick 3 areas on the lateral abdominal wall on each side, so 6 sticks total. And what we do is we identify the layers of the abdominal wall muscles using ultrasound guidance, external, internal, I mean, look at the size of this, and then the transversus. And then as we're injecting the needle, you could see it going in, and we go all the way through to the deepest layer and inject as we're coming out, so all 3 layers get the Botox. And as you can see, you could see the fluid actually bathing the muscle fibers, and it's really nice to see what you're doing actually going in the right place. You see the needle up there as we're going up. So here's the view of what it looks like. Look at this bowel peristalsing right underneath the last layer. This is why I like using ultrasound guidance. And a lot of people don't, but I like to see that I'm in the right layer. I like to see that we don't accidentally go too low. So this is the patient 4 weeks later. Look at how compliant his abdominal wall is. This is before we do the operation. It takes about 2 weeks for Botox to reach its maximal effectiveness, but it's best to do it at about 4 weeks later. So we did the operation 4 weeks later. Botox lasts about 3 months, but there are some lingering effects for another few months, so 5 or 6 months total. By that time the patient's healed, you no longer need the laxity. For this patient, I repaired him using the Reef Stopa technique. I did not have to do a TAR. I was very happy with that. He healed beautifully. He sent me these pictures. He loves to take pictures, so he wanted me to share these pictures of how happy he was with the results. He's happy, I'm happy, until recently. He came into the emergency room, and he has a bowel obstruction. But what do I look at? I look at my repair. How does my repair look? That's the first thing I care about. My repair looks good. I'm happy. Then we treat him conservatively for his bowel obstruction. He gets better in 2 days. He's happy too. He comes back to my clinic, likes to take pictures. We take this picture. He wanted me to share it with all of you guys. So that was my first Botox, and it's been love at first stick ever since then. And here's a few other cases that I did. So you can see the difference in what the abdominal wall looks like after the injection. Look at the laxity of the lateral aspect of the abdominal wall in this patient. Even with her obesity, you can see the change that happens with it. And then this was her operation, a TAR. I had to remove 5 pounds of excess skin. There she was at the end. I also used it in a little different situation of a patient with a really large diaphragmatic hernia. This patient had his entire liver, some colon, omentum, in a chronic diaphragmatic hernia. We were concerned about getting everything back in and maybe him developing compartment syndrome from putting everything back where it belongs. So we Botoxed him, did the operation a month later. Everything went in really easily and he did well. So the evidence for it is really increasing. There isn't a whole lot, but there's still pretty good information out there. So far, we know that it looks to be a very safe procedure. No reported complications of any of the cases that have been published so far. We also know that it does increase intra-abdominal volume. It increases the length of the lateral abdominal wall, and it does decrease the size of the hernia defect. And in addition to paralyzing muscle, it also helps with postoperative pain. So here's a nice picture showing how the abdominal wall increases in length. This is the pre-Botox, that's the post-Botox, and in dynamic images, the hernia defect itself is decreasing in size. There are some downsides. It is costly, and it's not always covered by insurance companies. I don't have that issue. I order Botox, Botox shows up, we're all good. But for some other people, the patients might have to pay for it. Also, it's off-label use. It doesn't mean that we can't use it in that case, but it's just important for you guys to know. And there are potential complications, local complications of infection, bleeding. If someone has neurologic issues, it can worsen with the Botox. There's a potential of toxicity, but it really takes thousands of units to reach toxic levels. And as Dr. Rigor Alvarez says, it's very expensive to kill your patient with Botox. So I don't think that's going to be an issue. The concern of spreading Botox with symptoms of botulism is low concern. And there's a potential of developing antibodies, but that really happens with repeated exposure. So aside from Botox, you have other options. Dysport has a little bit different dosing. Xeomin is nice because you actually don't get antibodies to it. So I'm going to make 2 very strong predictions standing right here, right now. I think that this isn't the last you've heard of Botox. I think that you're going to hear more and more about Botox in relation to the abdominal wall. Prediction number 2. Very shortly, I think that many people in this room are going to be enjoying a different form of muscle relaxation because Botox is not available here. So here are some papers if you want to read more about it. I'm not going to go through it because I have something a little bit better. And it's not just this beautiful artwork made by my kids for my talk. But it's a little summary poem that I made, hoping that you guys are going to remember the information that I gave. So here it goes. Here's my ode to Botox. Botox here and Botox there. In LA, there's Botox everywhere. Wrinkles are gone, anal fissures are healed, and big hernias are less of an ordeal. Muscle relaxation is a beautiful thing. Repair with Botox is like cake, but with icing. With all of the benefits, the cost is a steal. And I swear, Allergan hasn't bribed me, not even with a Happy Meal. So consider Botox injection for your hernia repair. It's a great addition to your armamentarium of care. Thank you.